And we as organized medicine must now be even more vigilant, more involved, more steadfast in our resolve that the implementation plans will make things better, not worse, for employers, employees, and most of all, patients. TMA has been involved in conference calls already with HHS, gathering information and outlining consequences and basically telling them the story of TennCare and our experience in Tennessee, not to make the same mistakes as they implement this law. We will continue to be a voice of reason, a voice for our members, and a voice for your patients as this law was rolled out. TMA wasn't on the sidelines when this was being debated. Neither will we be on the sidelines when the regulations are promulgated. And that's where the rubber's going to meet the road in this implementation. With health system reform basically dominating the news throughout the year, the other and probably more important and more pressing issue for you in this room is fixing the SGR once and for all. SGR, if you don't know what it is, the sustainable growth rate. More accurately, it's unsustainable growth rate. That's got to get fixed. There were several opportunities to fix this during the past year. And the Congress failed to do its job again. I just got off the phone with Senator Alexander and I told him just that. You left town and didn't fix this again. Of course, his comments were, well, it's the Democrats, they did this. I said, the Democrats weren't in charge back in '96 and on through. I said, you've been there long enough, you should have had it fixed. And we're looking to you as a leader of the Senate, the number 3 in the Senate from our state, to jump in and get this thing fixed once and for all. He said to tell you, he promised that he would go back in Washington. There's a vote Monday night at 5:30. He promised that he would vote to continue this for another month. I was kind, I'm not related to him by the way, I was kind enough to tell him I would pass that on to you, but I don't think you were going to be happy. I said, matter of fact, I said, you don't understand how angry doctors are. He said, oh yes I do. Dr. Woodbury just told me he was in Memphis with him today after he made a speech. He didn't want to listen to Dr. Woodbury. And that's where the way things are in Washington. It's amazing to me. At this moment, there are over 1 million Tennesseans on Medicare and TRICARE that are in a very precarious position. They can't find a doctor to take care of them. Even though the media, the pundits, and even Congress calls it a doctor fix, we know in actuality it's a patient fix. With dwindling access every day, patients are left in a lurch. And what did Congress do? It left town to go take junkets to who knows where, to do fundraising, hunt Easter eggs, whatever they do on that recess. They left town and left them in the lurch. And it's not just doctors and patients. There are 2 other big groups, the unemployed and those on COVID. They left them in the same lurch. They want to blame it on each other. They want to blame, the Democrats want to blame the Republicans. Republicans want to blame Democrats. We blame them all. And I'm going to ask you to do something. I think they don't think that you will quit seeing Medicare patients. They don't think you'll drop out of Medicare. I told him it's less than 30 minutes ago, that's happening more every day. He acknowledged that. And I said, AARP is on our side on this. They see that their members every day having more difficulty trying to find a doctor that will see them. I think they rely on you to, that you took an oath, a Hippocratic oath. I think they rely on you to be true to that oath. Best I remember, they took an oath too. And it's high time we held them to their oath. So I'm going to ask you, if you haven't called your senator or your representative about SGR, you need to do that. You need to do that. And when you do, don't be wishy-washy. Don't threaten them. And don't be wishy-washy when you call them. I think you need to be firm, you need to be forceful, and tell them once and for all to get this fixed. They'll say, oh, we're going to fix it. We're on your side. They'll tell you that. Don't hang up till you ask them and they tell you when they're going to fix it and how they're going to fix it. see a show of hands. Majority rule? I believe that to a degree. But I think it's more important to say that the majority that participates rules. I firmly believe that. It's amazing to me over the past year how many calls and demands that we got from TMA for action on health system reform or SGR. The demands came from non-members. We track those requests as best we can. And those who don't join the TMA, they don't get service. We think you that belong to the TMA have paid your dues. You're the ones that need to get service, and that's who we serve. And I'll speak more about that in a minute, or as my staff would say, he'll get on his soapbox in a minute. So where is TMA today? At this point in our annual meeting, how are we doing? I think if we were a patient, I think we'd be diagnosed as having the early signs of a disease. A disease that's easy to diagnose and is fairly easy to treat. And you've been part of this diagnosis over the last few years. And that diagnosis is declining membership. You've seen our membership drop 1% or 2% each year over the past 2 or 3 years. In other words, we're losing weight when we need to be gaining it. So what are we doing to address this backward trend and treat the patient? You know the process. You do a complete evaluation of the patient, a history and physical, if you will. We've been doing that over the past several months. We have a strategic plan in place. You've been privileged to be part of that planning process. If you listen to Dr. Minch the last couple of years, go over our strategic plan with you. We've asked the members what they think, what they want, what the priorities should be of this organization. We have a strategic plan in place. It was approved by the board last July. It's been published for everyone to see. The plan is well underway. As you can imagine, membership tops the list of where our priorities are. The board each quarter gets a progress report on that strategic plan. So making sure that our priorities that we've set, we're sticking to those. Because with limited resources, we cannot afford to lose sight of what's most important to you, the members. Dr. DePercio this past year he's had the entire leadership involved in membership. Some of you have responded to his campaign. Some of you haven't. Some of the board of trustees responded to his membership campaign. Some did not. That campaign continues, and it has to continue, and we have to increase membership if we're going to have a strong, viable organization for the future. Now for my soapbox. Rather than focus on what TMA does for its members, that's what we do this year, at this time every year. Here's what we do for our members. I'm going to talk about, and believe me, we do more for our members, and we do it better than we ever have. Seems though that a lot of the non-members don't appreciate that. You do. You know the value of membership. Otherwise, you wouldn't be here. So I want to focus on what will happen if our membership does not reverse. If we don't reverse this trend, what's going to happen? And I have limited time, I know that, but I'm going to focus just on our advocacy issues. And we can't sustain our success that we've had, and we won't sustain it if we don't have membership dues increased. Let's talk about a couple of insurance hassles, for example. The progress we've made through our class action lawsuits and through the legislature that now require insurance companies in this state to pay you within 30 days for a clean claim. Even if they don't, you can even add penalty and interest to that. Well, if our lobby went away or is greatly diminished, you're not going to get paid in 30 days. We're going to go back to the 60 days, the 90 days, or whenever they get around to paying you. And that was the standard. That was the standard before TMA went to court for you. You're going to lose that. You'll lose it immediately in the legislature. Insurance industry will wipe that law out. On the legal front, just within